Periosteum ka elevate na yan. Why? Because this is normal bone, okay? And the normal bone is covered by periosteum. This bone is covered by the periosteum. Just about the periosteum, there is neurovascular bundle. Okay. So whenever there is fracture or when we operate it, we have to reflect the periosteum in order to prevent injury from the neurovascular bundle. Oh, yeah. Look at this. So when operating, there will be neurovascular bundle around here, posterior tibial lateral. Okay. Maka in operation, we have to elevate the periosteum. Periosteum is a thin layer covering the bone. In order to prevent injury to that vascular structure, we have to elevate using this. Oh. If my hand is bone, so while operating, we have to insert the periosteum and elevate the periosteum like this. Okay, so that the neurovascular bundle coming around here will be away from the bone. This is called periosteum elevator. In all the fracture case and including malignancy of the bone, we have to elevate the periosteum, except in osteochondroma, except in osteochondroma, because in osteochondroma, the malignancy, the benign tumor arise from the periosteum. For example, in that case, you should not use this one. You have to excise in total. Everything should be removed, including the periosteum and the bone. Except only that's the excuse. So this is called periosteum elevator. So after elevating the periosteum, this is also a type of periosteum elevator, but we usually use as a bone lever. Okay, this is called bone lever, and the exact bone lever is we already autoclave it because tomorrow is our 40 day. The bone elevator is it should be like this. It comes like this. It's on curved day. It's on curved day. Yeah, hold on. So after elevating the periosteum, we have to elevate the bone. Okay, this is called bone lever. Just to elevate out the bone. So for example, if I'm operating this one, this segmental fracture, I have to elevate the bone fragment. So using this bone lever, we will pull up. It's a kind of. This is called bone lever. Then after reflecting the neurovascular bundle and elevating the periosteum, then elevating the bone, we have to use this one. This is called bone holding forceps. This is called bone holding forceps. It's an hold you. A bone fragment is a hold. After that, step by step, periosteum elevate. Then using a bone lever, you have to elevate out the bone. Then after that, you have to hold the bone. Then after holding the bone like this, some of the bone fragment will be spiked, pointed spike. The unwanted fragment you should cut using a plier, using a bone cutter. We have to cut the sharp fragment using bone cutter. This is called bone cutter. There are various types of bone cutter. These are two-way. Two-way means I press down, then it retract. Spring over. Two-way. So number one is we elevate, in any fracture case, we elevate the periosteum using periosteum elevator except case of osteochondroma. Then the fragment is lift out using bone lever. Then this is holding the fragment using bone holding forceps. After that, all the bone spike or any bone graft needed, which you should cut using bone cutter. So you cut the bone, then in some part you have to use this type. Look at the edge and this one. Compare it. Blanco. So whenever you look at any osteotomy, you have to do two. Number one is look at the tip. One should come like this and one should come like this. Other one is it will come like this. Osteotomy chichaka. So that one is one. Bevel in both side. Beveling of both sides. Anyazu. So if it is pointed on both sides, it is called osteotom. Then other one is bangale, beveling one side hele. So it is called chisel. Chisel. So the bone growth or any osteomyelitis or anything, you have to cut using these two. Any bone growth, if you are planning to remove, you can use this osteotomy or chisel. But the main use of osteotomy is for osteotomy around the hip joint. Like McMorris osteotomy, Powell's osteotomy, we have use all those. Okay. In case of for chisel ka, chiseling out the bone. Osteochondroma, any bone growth you can do. Okay. The difference is that they'll ask you only the name. You have to differentiate this. Hindi na chisel kaya. So look, one side is bevel and one side is flat. This is both are bevel. If pass on mo, compare ngayon si kilo. Single cut so no so confused. Then this one is Carfield's bone gauge. ZAOZ bone gauge. This bone gauge is used for making a hole in the bone to remove, in case of infection and all, to remove the dead bone. Or it can be used in taking a bone graft. Bone graft in bone gauge. So these three are very confusing. Hindi ko confusing sino ang long way. So if you want, the patient is having chronic infection inside the bone. Infection of the bone and marrow is called osteomyelitis. In case of infection of the bone in the marrow, you have to remove the dead bone. Dead bone is called sequestration. Why you have to use this bone gauge to remove the bone?